I'm Kearney and I'm an occupational therapist currently working at Salford Royal Hospital. I'm giving my time today to make this video in the hope of encouraging others to join this fabulous profession in the future. I would like to increase the awareness and understanding of occupational therapy as a profession, as I really feel that it's a very rewarding career. So from a young age I knew that I wanted to pursue a career in healthcare, however I had great difficulty in identifying which specific profession it was that I wanted to be part of. When I left school I completed a degree in health science and physiology, and it was during this time that I was introduced to occupational therapy. When my grandmother was diagnosed with a mixed dementia, her occupational therapist played a massive part in supporting her to live her life the way that she wanted to, despite the difficulties that she was then facing. I was really inspired as I realised that working as an occupational therapist would then allow me to make a real difference in society. So occupational therapists work to support people to do anything it is that they want to do, need to do, or are expected to do in the course of their daily lives. So we support people, be that from very young children to very old adults and everybody else in between, who have been affected by illness, ageing or accident to achieve their full potential. So I'm currently working on the Ageing and Complex Medicine wards at Salford Royal Hospital. So as you can probably guess, I work with older adults, many of whom have long-term complex medical conditions. A typical day for me starts at 8 AM when I begin to screen my ward to prioritise who it is that I need to see then during the day. I look for any new patient referrals and check the current patient notes to ensure that nothing has happened to them overnight. During my day I liaise with doctors, nurses, social workers, discharge coordinators and other allied health professionals to ensure the best outcome for the patients that we see. I'm very conscious of the fact that every individual patient I work with will have their own specific needs, and what works for one will not necessarily work for another. My input with patients varies greatly. Some people may be struggling with simple things such as getting in and out of bed independently, and I can then provide them with a piece of equipment to support with this. Others will need me to look at more complex cognitive assessments, looking at their memory and thinking skills, so that I can then make an informed decision as to what it is that they need and what will help to enhance their lives. Sometimes we need to branch out and go and see people's home environments and see what it is that they're struggling with, just so that we can get a clearer picture of what it is that they would then benefit from and what would support them to remain at home for as long as possible. Some of the cases I work with are very challenging and very complex. However, the personal satisfaction I feel from knowing that I have contributed to making my patients' lives the best they can be is very rewarding. In my opinion, the main skills that I have developed and that are necessary to succeed in this career are being a good listener and being observant. Everything that I do has to remain patient-centred, and so I need to adhere to what it is that the patient wants. But I also need to adhere to the guidelines and the standards for my practice. Prioritisation, organisation and communication skills are also very, very important, as I have a very demanding caseload and I work with numerous people, patients, their families and carers and other professionals on a daily basis. Years ago, my grandmother used to say to me, "If you love your job, you'll never have to work a day in your life." Although I didn't really give this much thought at the time, now I realise that even though I'm quite young and relatively new in my career, that she made a very valid point. I'm very excited about my career as an occupational therapist and what it has to offer me in the future. My advice would be to find a career for yourselves that will give you equally as much personal satisfaction. I'm totally committed to my profession and I feel this is what's essential to help you succeed in the world of work. Thank you for taking your time to listen to me, and I hope that I meet some of you as occupational therapists in the future.